Stress, burnout, vicarious trauma, and compassion fatigue are common workplace challenges for individuals in social service roles. Peer supporters may experience these challenges in unique ways because of their peer position, and their recovery perspective can provide unique strategies for how peer supporters approach self care. Burnout is when stress from work or personal obligations becomes overwhelming and unrelenting. In social services, it can take on unique forms. Quote, burnout in the human services field can involve three components: feelings of emotional exhaustion, depersonalization of clients, and a low sense of personal accomplishment. One misconception about peer supporters is that they are too fragile to handle the stress of the job. This is false. Peer supporters are just as capable of handling job stress as any other staff member. In one study comparing peer support specialists and non peer mental health workers in the VHA system found that no difference in burnout rates. In fact, research can indicate that rates of burnout tend to be lower for mental health workers who are in recovery oriented systems. Jobs in mental health settings are stressful for everyone, not just peer staff. As a result, self care is an important area of focus for all mental health staff, not just peer staff. It is true, however, that peer staff are asked to take on additional burdens of disclosing some of their most personal experiences and putting these experiences to good use in helping others, as well as bearing the additional scrutiny of having to represent all peers. In other words, if they do not do the job well, it may factor in whether or not the agency will continue to value peer services. After the COVID-19 pandemic, many peer support organizations in Pennsylvania began to experience a shortage of peer supporters. While this has had the unintended consequences of increasing compensation and benefits for some peer supporters, such as increased wages and sign on bonuses, this also exacerbates the workload and stress for peer supporters who are working in understaffed programs. Of course, understaffed peer programs is not a new issue, and we understand that working in an understaffed facility can have a great impact on workers. Participants reported lower hourly salaries than for other positions, even though there is still an ongoing shortage of peer support specialists at the agency. This shortage was especially prominent on the intensive treatment teams. Participants noted that one peer support specialist is assigned to each team, leaving them to cover large numbers of individuals. There are many factors that contribute to burnout, which we can identify based on the areas of work life scale. The first is workload. An unreasonable workload can be exacerbated by an understaffed workplace or high turnover, causing increased work for remaining peer supporters. It also occurs when there are poor job descriptions or unreasonable job expectations, such as when peer supporters are expected to take on other job roles that are not peer based or just to fill in wherever there is low staffing. A lack of control over your own tasks, the way that work gets done, or a lack of input over important decisions that affect your job. One example of this is micromanaging. This often comes from a distrust in people in recovery or low confidence in the capability of peer supporters. As discussed, while providing support and helping the community can be greatly rewarding in the sense of personal accomplishment and pride, tangible rewards for peer supporters are also important. But if the workload is too high, the personal rewards of the job can be less effective. Possible tangible rewards can include compensation such as bonuses and raises, career advancement, access to perks, recognition, and praise. We have already described the great impact that the acceptance or discrimination on the part of non peer staff has on the experience and success of peer supporters. On the other hand, peer supporters, based on the nature of their work, are in a good position to provide a sense of community support to their fellow peer supporters. Accessing or lacking this kind of community can minimize or exacerbate the effects of burnout. Many peer supporters reported being treated as second class employees compared to their non peer counterparts. This unequal treatment can actively make jobs harder for peer supporters, such as when peers are barred from having access to participant records, peers are not allowed to use the same workplaces as other employees, and when non peer staff belittle or stigmatize CPSs in front of participants. A lack of fairness can also manifest in a lack of investment, such as when organizations fail to provide livable compensation, adequate work equipment, access to supervision, and continuing education opportunities. The embodied values of the organization can be a strong predictor of success for peer supporters. As Weichel and Fisher have outlined in their study of burnout and turnover among peer providers, quote, value discrepancies would be a stronger predictor of burnout amongst peer providers than among non consumer workers. Of course, although dissatisfaction with community interactions and with the values of the workplace may occur among many peer supporters, it is noteworthy that some peer providers work in agencies known as consumer run or peer run programs, or programs which are naturally recovery oriented in which most employees are peer providers. The impact of organizational values on peer workers strengthens the argument for why organizations should make the effort to become more recovery oriented. All of these factors can contribute to worker burnout, but it is also in these areas where protective factors can be put in place to safeguard against burnout. Vicarious trauma, or secondhand trauma, is the emotional residue of exposure that social service workers have from working with people as they are hearing their trauma stories and become witnesses to the pain, fear, and terror that trauma survivors have endured. This is based on research that shows how witnessing or hearing about traumatic events can have a similar effect to if they had experienced that traumatic event themselves. The peer aspect of this work may make CPSs vulnerable to re traumatization, particularly if they have similar experiences to their peer. While on the whole, shared experience is a strength, it can also be a stressor for the peer supporter. Compassion fatigue is often described as simply the cost of caring. It usually affects individuals working in settings that require emotional labor and empathy, such as in healthcare and social work settings. Compassion fatigue is stress that occurs as a result of helping those who have experienced trauma or are coping with emotional duress. It can often be seen as a consequence of burnout and secondary trauma and can result in harming CPS's ability to respond with empathy. The British Medical Society has outlined several risk factors that can indicate vicarious trauma and or compassion fatigue for people in care professions. These include experiencing lingering feelings of anger, rage, and sadness about a client's victimization, becoming overly emotionally involved with the client, experiencing bystander guilt, shame, and feelings of self-doubt, being preoccupied with thoughts of participants outside of work, over identification with the participant, which could include having horror or rescue fantasies, loss of hope, pessimism, cynicism, distancing, numbing, detachment, cutting off clients, staying busy, etc., avoiding listening to the client's story of traumatic experiences, or avoiding working with the client altogether. Difficulty in maintaining professional boundaries with the client, such as overextending oneself or trying to do more than is appropriate for the role. Fortunately, they also outlined many strategies for preventing and addressing these issues, which include increasing your self observation, recognize and chart your signs of stress, vicarious trauma, and burnout. Take care of yourself emotionally. Engage in relaxing and self soothing activities, nurture and self care. Look after your physical and mental well being. Maintain a healthy work life balance. Have outside interests and make sure to be physically and emotionally be ready to leave work at work. Be realistic about what you can accomplish and avoid wishful thinking. Don't hold yourself responsible for your participants' outcomes, but supply them with tools to look after themselves the best that you can. Maintain a reasonable caseload and balance your caseload. If possible, have a mix of clients with more and less trauma history. Take regular breaks, including taking time off when you need to. Seek social support from colleagues and family members. Use a buddy system at work, which is particularly important for less experienced CPSs. Take up training opportunities, particularly in topics of vicarious trauma and self-care. Use peer support, supportive supervision, and find opportunities to debrief your work experience. Of course, peer supporters are particularly well positioned to provide support with each other. Additionally, their personal experience of recovery makes them more likely to have already developed personal strategies for managing stressors and are more likely to already have self-care plans in place. But as this toolkit further details, eliminating workplace stressors cannot be solely done by the employee, but rather must include an institutional commitment to supporting the self-care of its employees.